Very good day to our beloved viewers. We are back with our series on COVID-19 and engineering. My name is Aiman and I will be the presenter for this session. In today's video, we will look into data analysis of COVID-19 infections in Malaysia from December 7, 2020 until February 4, 2021. Infection cases increased double in 30 days from about 2,000 cases on January 5th to 4,600 on February 4th. The graph shows the daily new confirmed COVID-19 cases in Malaysia, which was obtained from the website ourworldindata.org. During this period, as shaded in yellow, the rate of increase is much steeper than previously, which means the infection was much more serious than before, partly after the Sabah by-election. It appears that the infection rate is getting stable after February 4th as seen in the graph. Looking at overall cumulative infection graph, we have not yet flattened the curve as the cumulative number keeps increasing in a linear trend. What are the biggest COVID-19 clusters for the past 2 months? We will look into the breakdown of COVID-19 infection clusters. We obtained this data from the STAR online website. We try our best to extract as much information as possible from the information available. We also notice some classifications are repetitive, but we do not know how the classifications were done. The image on the right, or also called circular tree map, shows the hierarchy of clusters that have been contributing to the growing numbers of COVID-19 cases. The bigger the circle, the higher the group contribution to the number of COVID-19 cases. The biggest circle is the workplace. The bar chart indicates that 3 largest clusters are from workplace by 28%, prison and detention center 6%, and interstate travel 1.8%. These clusters contribute to almost 42% or 65,000 of all cases. The other 57% are summation of small clusters, which include hospital screening, Siri screening, community screening, symptomatic screening, and etc. As can be seen, other clusters like close contact, family gathering, high-risk infection, and religious gathering are very small, less than 1% each. We further break down of the workplace cluster as shown in this graph. As you can see, the biggest contribution comes from symptomatic screening, targeted screening at factory, workplace screening, and construction site that caused the spike in numbers of COVID-19 cases. What do we understand from this data? Almost 30% or 46,000 cases came from workplace cluster. The workplace cluster are mostly at construction site, factory, and supermarket. There is no evidence that construction site itself or working area can spread the infection as normally it is outdoor. Most likely reason is the close quarters living conditions of the workers. Infection can happen because the living conditions of workers in kongsi, dormitory, and hostels are packed close to one another and unhygienic, thus make it more susceptible to infection. Another reason is the working place if it had low indoor air quality in the working spaces, which contribute to high infection rate. The fact shows that community infections from religious, community, family, and wedding gatherings are low, and it can almost be negligible. So, what should be our action plans to curb this infection? The Pareto principle states that for many outcomes, roughly 80% of consequences come from 20% of the causes. Therefore, priority should be given to the highest contributor of the cases, which is the workplace. Firstly, there is the need to step up the enforcement of the SOP at factories, construction sites, workers' hostel, and prison. More resources should be deployed to these premises in order to check the compliance to the SOP. Do not be afraid to penalize the employees and employers which do not abide with the SOP, as it will cause more harm than good. Secondly, reevaluate and redesign the centralized air conditioning unit at workplace, such as offices, malls, and supermarkets. A proper design of centralized air conditioning unit can ensure a good indoor air quality, which can reduce the risk of infections. Last but not least, risk assessment process using big data, data analytics, and science must be applied. Big data and data analytics will help us to determine the cause of the infection. From there, we can evaluate based on science for the action to be taken. These steps would help us to determine the best and most effective actions to curb the infection rather than creating unreasonable SOPs without any scientific evidence. There is no point trying to tackle less impactful clusters using so much resources. For example, the SOP to limit 2 persons in a car from same family members, or limitation of not more than 4 persons even with masks, and social distancing for outdoor activities do not make sense. As we have been saying, engineering controls must be practiced to control COVID. With that, we would like to thank our viewers for listening. We hope you gain a valuable insight and knowledge from this sharing session. Don't forget to hit the like button and subscribe to our channel for more interesting videos. Stay safe everyone. Kita jaga kita. Remember, kita jaga kita. Thank you.